Frozen shoulder is something that's quite hard to understand because we don't understand why it happens or why it gets better. But ultimately, from a patient's perspective, they're going to experience 3 different phases in their shoulder. The first thing is they're going to get pain in their shoulder without having had any trauma or injury or anything else like that. Then they're going to lose movement and they're going to get a very stiff shoulder which they can't raise above their head, can't rotate around to their back or can't turn outwards. And that's the frozen part of the shoulder, is that it doesn't move nicely. It happens in about 3% of the population. We don't understand why. It is more common in diabetics and people with thyroid disease. So if we do see someone with a frozen shoulder, we always get them screened for those 2 conditions just in case. And it's interesting how many people actually end up becoming diabetic later that have had a frozen shoulder. Having said that, the treatment for a frozen shoulder generally is simply to understand the condition, understand that there isn't anything significant wrong that needs intervention. Now sure, we're going to provide painkillers for them, we may give an occasional cortisone shot, but surgery for frozen shoulder is very rare. What happens over an 18 to 24 month period is the process reverses itself and the shoulder simply starts to move better by itself. And after 2 years or so, sometimes a bit longer, sometimes a bit shorter, the movement just comes back to the joint, the pain goes away and your function gets restored. There's a small subgroup of people, particularly the diabetics, who don't restore all of the movement and they may need surgery to release the shoulder. There's another subgroup of people, for example, electricians, scaffolders, who need the movement for their day-to-day life, and so they may choose to have some injections done earlier or some surgery done earlier in order to restore function for themselves to get them back to work or activity sooner. But for the most part, frozen shoulder is something that will go away by itself and doesn't need intervention from a surgeon.